And we are officially starting the Crisis Jam. It's the 199th episode. And my name is Megan Haupt. I'm Chief of Staff with the National Association of State Mental Health Program Directors. This episode really addresses the intersections of indigeneity and queerness. We are so delighted to have Jericho Cummings as our featured presentation. So we will talk more about that. Did want to go over that this is where the website where you can find past episodes, videos, materials, and how to register for the Crisis Jam. So if you're watching this by YouTube, this is where you go, talk.crisisnow.com. And again, past episodes in California was last week with Mark Saville. His name rhymed with gravel. I remember he said that. So anyway, and let's go to the next slide. Wonderful. And just wanted to note that 988 on SAMHSA, SAMHSA's 988 has so many resources, just rich resources. And in particular, there are so many resources regarding LGBTQ plus and in that space. And we wanted to just kind of go over some of that. These beautiful images of caring, loving images, and just know that these images and the resources on the SAMHSA website are available. So it's wonderful. Yeah. Whoever takes those images does such a nice job. Wanted to highlight in Teen Vogue that there is a youth line starting a crisis line run by Native youth for Native youth. And it really is built upon the Native and Strong line that is for adults. So this is just really great that there's a youth line starting for this. So check that out. And also, this is a really important piece. The Trans Lifeline has concerns, understandably, about the engagement of law enforcement when people call 988. And it really, we so appreciate this issue being raised because there's this tension between the rights of individuals and those concerns of family and friends, as well as professionals, and just that tension, yet trying to keep people alive. So we just appreciate the Trans Lifeline continue to raise this issue, hoping to find that kind of balance. We also wanted to highlight that there are several polls. So public awareness of 988 National Suicide Prevention Hotline is low, but it's growing. So that's an important piece. At this point, our understanding is that about 15% of Americans understand that 988 is available. So we definitely want to do more outreach, but this kind of gives us a barometer for that. Thank you. We are now going to do the Crisis Trivia Hot Seat. This is going to be an audience participation. And SAMHSA's 988 BHCCO, which is the Behavioral Health Crisis Coordinating Office, is revolutionizing crisis care with its mission to ensure anyone, anywhere can access seamless support at any time. This groundbreaking effort mirrors the transformative impact of 911 and the Office of Emergency Medical Services, which began in 1973. So, in which department is the Office of Emergency Medical Services housed? Now, this is a very interesting piece. It could be Centers for Medicaid and Medicare, Health and Human Services under the Assistant Secretary for Preparedness and Response, otherwise known as ASPR, FEMA under the Department of Homeland Security, or the National Highway and Traffic Safety Administration under the U.S. Department of Transportation. So everybody put in your choice in that poll, not in the chat box, and let's see what we come up with as an audience. We normally have a very intelligent audience. We've got this. Let's take a look. Everybody got their answers in? All right. Let's see. Pretty split. Yeah, it seems intuitive that it would be the Health and Human Services under ASPR or ASPR. However, let's take a look at what the answer is. Isn't that fascinating? It is the National Highway and Traffic Safety Administration. So following the Highway Safety Act of 1966, which was authorized the U.S. Department of Transportation to oversee highway safety and emergency medical care, NHTSA established the Office of Emergency Medical Services to lead and coordinate the development of EMS systems nationwide. So essentially they were, we were talking about this in what we call the run-through or the green room, and they were concerned about traffic accidents. And so that it has continued to stay under the NHTSA. So thank you. We are very excited to have Jericho Cummings be our featured presentation on intersections of indigeneity and queerness. Jericho is a member of the Cheyenne River Sioux tribe and serves as the 2 SLGTQ+ training and community engagement specialist for the Paths Remembered project at the Northwest Portland Area Indian Health Board. Personally and professionally, they feel called to spaces where they can exist and support community at the points where indigeneity, sexual orientation, and gender identity all intersect. Jericho, I'm going to turn this over to you. Thank you so much for being with us today.
Thanks for having me. Feel free to advance to the next slide. I just want to share a little bit of information about the Paths Remembered project at the Northwest Portland Area Indian Health Board. Here at NPAIHB, we serve the 43 federally recognized tribes in the states of Washington, Oregon, and Idaho. Paths Remembered is our Northwest Tribes Two-Spirit and LGBTQ+ health equity initiative. We're very lucky to have the funding that we receive and to expand this work outside of the Northwest and to offer our services and education, research, all of the things that we're able to offer to tribal communities, community-based organizations, and other health professionals and folks working with American Indian and Alaska Natives at the intersection of their gender identity and sexual orientation. Our website is mentioned here on the screen, and I'll be happy to drop a link to it later on when I'm finished here. Feel free to advance. And so I kind of want to start by explaining a little bit about this Indigenous ethos of care. In many of our tribal communities, we have this phrase or saying, all my relations, or we are all related. As you can see on the image here on the right, there's a whole lot of human relatives depicted, but in between each there are various animals and creepy crawlies and aspects that make up our natural world as well. And so in our culture and in our communities, we believe it to be a philosophy and value and belief of ours to act in good relation, not just with one another, our human relatives, but everyone else in the natural world. And there's not a whole lot of a forethought, if you will, that goes into how we act in these relations. We're taught specifically how to care for one another and to value the world and the natural beauty that exists around us. But then from that point on, it kind of becomes accustomed to us that we continue to act in this good way. Um, but bringing things back to our American Indian and Alaska Native, Two-Spirit, and LGBTQ plus community members, we need to think through some additional ways of offering this support to show them that we care about them, that they matter and have a place ultimately in our circle, and that we view them as our relatives as well. And so thinking through here, the topic of the intersection of indigeneity and queerness, and using queerness as a term very much so to capture the broad array and diversity that exists in our communities at the intersections of gender identity, sexual orientation, spiritual identity, racial identity, ethnic identity, all of those things. And so I hope some of the information that I have on the coming slides can help you understand a little bit more how to make these practices and adopt them as well to fully affirm and meet the needs of Two-Spirit and LGBTQ plus communities. Next slide, please. And so something I want to draw attention to here around gender is the ways in which it can be experienced. Individuals may experience their gender as it pertains to various cultural aspects. It's very much so rooted in our social dynamics. Folks can experience it individually, but also on a collective level. It has ties to spirituality, individuals' emotionality, and it can also be experienced physically, all of which can take place at the same time. And one thing that I really appreciate about the vastness and diversity as it pertains to gender is that it doesn't exist on a spectrum with polarizing ends where one is logical and the other illogical, or one where we focus solely on biology and biological makeup, and the other aspect where it's entirely socially constructed. There's an ebb and a flow between both points, and all of it makes up the I guess like complicated nature to ultimately explain what one's gender is. It's much more tied to their own individual experience, and very much so varies based on an individual's culture, can vary over time, as well as having an impact on the institutions and systems that we have to navigate, both in an unfortunate sense, and then there's also a bit of beauty that's attached to that as well. Next slide, please. And so I was asked to share a little bit about what the Two-Spirit definition is, how it's made up, and ultimately who does it encompass. In our work specifically, we like to add the 2S abbreviation, if you will, to the front of the 2S LGBTQ plus acronym, because our communities have honored and embraced this way of knowing, being, and existing pre-colonization. And so I'll get into that a little bit more. But when we're talking about Two-Spirit community, I'm referring to an Indigenous person who expresses their gender identity, their sexual orientation, spiritual identity, or social role in a traditional or non-Western way. And so focusing here on the traditional or non-Western way comes back to the ways in which our communities accepted and embraced gender diversity, various forms of sexual identity and sexual expression, pre-colonization. There wasn't a whole lot of, I guess, like scrutiny or discrimination or othering that took place in our communities. Folks that existed outside the gender binary and did not participate in heterosexual romantic or physical unions were embraced. There was no eye batting or any sort of difference and any sort of negative connotation attached to those identities, experiences, and lived realities. The ways in which we see this applied more so specifically today with the impact of colonization and the ways in which knowledge about Two-Spirit people has been not entirely lost, but less discussed and talked about the experiences our community members had faced throughout the boarding school era, and that still has lingering effects today around the ways in which the rise in patriarchal family systems, the ways in which we think about heterosexual unions and the prioritization given to cisgender, straight unions and dynamics and identities are largely having to face more of a reclamation and resurgence. And that's where we see a lot more need around support and visibility and ultimately advocacy for members of our community that identify outside the gender binary and do not identify as straight or heterosexual. And a little bit more background information about this term. It originated in the early 1990s and was first coined by Myra Laramie, who is a Fisher River Cree member, I believe, from a reserve in Canada. But this term is seen as a unifier and a stand-in for words denoting various 2S LGBTQ plus ways of being and meant to encapsulate all of the various tribal languages that could not be lumped up into one word. But the key here is that this term and ways of knowing and being are inextricably linked to one's gender, their orientation, as well as their experience of indigeneity. Next slide, please. And so just a few quick reflections from our work over the past 5 years through a survey that our program conducted. We found that about half of our Indigenous 2S LGBTQ plus community members identify as trans or gender diverse. And then the majority of the Indigenous TGD folks, they identify as Two-Spirit, and they're also showing up 5 times as more likely to use this term compared to their cisgender queer respondents. And ultimately, through some follow-up surveys, found that this gravitation towards identifying with the Two-Spirit identity is a way to shy away from Western conceptualizations of gender and to connect their gender identity back to their indigeneity, which is super special. We're, as I mentioned earlier, still in that process of reclaiming, and many tribal communities and Indigenous individuals are starting to share more information about Two-Spirit history, ancestry, and also carving out new ways in the present day for affirmation, representation, and participation in our traditional values and spaces as fully Two-Spirit people. And another piece building off of that, Indigiqueer folks in both rural and urban spaces are reclaiming space, both physical, social, mental, if you will, spaces in our traditional communities and more so our ceremonial communities. And we see them creating community now more than ever when we can turn to the rise in various Two-Spirit gatherings, events catered to and hosted by the Two-Spirit community meant for their participation, as well as our accomplices as well. And so it's a wonderful time to be involved in this work, creating the resources and ultimately bringing greater awareness to our Two-Spirit and Indigiqueer relatives. Next slide. I'll gloss over this one, but one key aspect from this is that in more mainstream LGBTQ plus research, there's higher ranked, how do I phrase this? Individuals, when asked to rank key aspects of their identity, sexual orientation and gender identity are most often in the 90th percentile of being key aspects of one's identity. And so when we asked our survey respondents the same question, they ranked their Indigenous identity to be much higher than their sexual orientation and gender identity. And so that made us curious, like why are folks ranking sexual orientation and gender identity lower? And through some follow-up interviews found that it wasn't that these weren't important aspects of Indigenous people's lives and their identities. What they shared with us is that they experience their sexual orientation or their gender identity more so through their Indigenous identity, their understanding of history and their tribal identity. And so really wanting to call attention and honor their Indigenous identity and their rich cultural heritage. Next slide, please. And so there are some misconceptions by some that gender neutral pronouns, the use of chosen names, or going by a different name are more rooted in Western culture or are not uh, products of our Indigenous traditions and cultures, if you will. And so dating back throughout tribal history, there are many tribes and communities that have embraced and utilized gender neutral pronouns, and they don't focus so heavily on the gender binary as our language construction does today. And thinking through chosen names and the use of nicknames, there are many in our communities who we don't even know their given name. They might go by a totally out of this world nickname, and we accept and embrace that. There's not a whole lot of questioning or prying into what their given name is. And we want to offer that same level of affirmation and limited questioning when folks come to us and say that they want to go by a name that's different than what was given to them at birth. Opting to use one's chosen name and their correct pronouns is another act and way that we can show folks that they're a part of our circle and that we view them as our relatives. And another key piece here in relation to the status culture and role of elders is that there's this constant need of continuous knowledge acquisition. I believe that's a part of what it means to be an elder. And sometimes we hear that the use of neopronouns or different names and things like that are a fad or something that the young folks are pulling from TikTok, and that it'll shy away in due time when the next fad comes. And that's not the case. And so we want our elders and everyone in community to continue learning in this regard with us. Next slide. One thing I want to share is that Two-Spirit, Indigiqueer, and tribal genders are often viewed as a space in which validity and identity, belonging, sacredness, and responsibility are all called, found, and formed. There is no one right way for someone to embody their gender. And often this journey of gender embodiment involves what resources someone has, their social networks, cultures, counselors, providers of all sorts at the time. Next slide, please. And wrapping up, I just want to share that in our cultures, there's a great emphasis placed on the whole, especially around our health and well-being, and family is incredibly important. But due to the ways in which many of us experience our families or communities of origin, we construct these elaborate intertribal family units that function like proxy tribes, and they're oftentimes made up and deeply connected to our birth families or our blood relatives, our extended families, chosen families, tribal communities, and even some of the individuals and tribal organizations that serve our communities and meet our needs. So thinking through this gender collective experience and way of thinking, how best can we bring in various folks to support one another and create resources that ultimately affirm and meet the needs of our community members. On the next slide, you can learn more about the PAS Remembered project. We have a presence on Instagram, weekly text messages that we send out. And with that, I'm very lucky to have two wonderful colleagues of mine from various projects at the Health Board speak to some of their experiences working in community as well to affirm and support Two-Spirit, Indigiqueer, trans, and gender diverse community members. So I'll turn it over to Taylor Dean and Christy Holder.
Good morning. My name is Taylor Dean, and I am the Healthy Native Youth Outreach Specialist at the Northwest Portland Area Indian Health Board. I am a member of the Puyallup tribe in Washington State, and my pronouns are they, them. I'll get into a story in a minute, but I'm going to let Christy Holder introduce herself very quickly.
Hi, good morning. Christy Holder here, the Thrive 988 Project Coordinator at the Northwest Portland Area Indian Health Board. I am Chinook and Grand Ronde in the state of Oregon. Thank you for having us here today.
So in my job, I am on the Healthy Native Youth Project, which works with teachers, parents, caring adults, social workers, counselors, anybody who works with and engages with Native youth, as well as family members. And part of my job is holding trainings for these adults who work with youth. Every year we have something called the Thrive Conference, and this is our youth suicide prevention summer camp. And we teach young people about coping skills through art, music, and culture. Part of this experience is the youth come with mentors and chaperones who help take care of them throughout the week, help watch over them, and make sure that they're safe in the city of Portland when we're not there taking care of them. And we do trainings for these mentors while the kids are in their activities. So last summer, I was responsible for our Two-Spirit LGBTQ training for the mentors. And I wanted to share this story because it is a living example of what this work that Jericho Cummings is talking about looks like in the real world. I sat down, I turned on my computer, I gathered all of the mentors together, and I introduced myself, gave my tribal affiliation, my pronouns, and I started out our activity with having everyone go around the room and introduce themselves, their tribal affiliations, and their pronouns if they felt comfortable. And at a certain point, it got to a gentleman who was an elder in the room, and you could tell his feelings were very negative. He said, "I don't do any of this gender stuff. I'm old school." And that was kind of like a moment that sucked the air out of my lungs. And it was a very awkward moment for me because in our culture, we're taught to have a lot of reverence and respect for the wisdom of our elders. Um, and I know that we have to walk a difficult line when we communicate with them. So, I let him say his piece, and then we went on to the next person, and I started my presentation. In my presentation, I talked about a lot of the things that Jericho talked about the history of Two-Spirit people, this idea that LGBTQ and transgender and gender nonconforming people have a long history in our culture that goes back till time immemorial, and that we also talked about how there's evidence that using correct pronouns and affirming transgender youth is suicide prevention and helps reduce risks for youth. After my presentation, we had a discussion, and this is kind of where a lot of the tension began. I I was nervous to confront this elder about the way that he felt about young people because he very much had that idea that, like Jericho said, that, this gender stuff comes from TikTok or it comes from the white folks. Um, and it was hard. And I was really lucky. And I want to emphasize the importance of allies in this moment. I had my intern with me, who is a cisgender older man. And he really laid it out beautifully to this elder that it doesn't matter if, you agree with it necessarily or you understand it, but what matters is that this is where the youth are at. This is what matters to them, and this is how we can help them live happier and healthier lives. And that took such a burden off me, and it really reached this elder, and I felt like we were all able to kind of like come to an agreement that we're all there for the youth. We want to help youth. And that was a really beautiful moment for me to be able to say my piece in a professional way and then have somebody with a backup for me. So if this doesn't tell the story of how important allies are to our community, I hope that you can understand. Thank you for listening to my story, and I'm going to pass it off to Christy to talk a little bit about herself, her project, and share some resources with you. Thank you.
Wow, Taylor, thank you so much. How do you follow that, right? So I'm the Thrive 98 project coordinator. I'm fairly new to the board. I come with 15 years of public health experience. And today I just kind of want to share what the Thrive 988 project is. Thrive is an acronym for tribal health. Reaching out involves everyone. And Taylor shared a lot of what we were already doing about that youth conference that's held every year. And we're also doing a lot of 988 resources and sharing information. And a part of that is some video campaigns that we're doing. We're really trying to jump into lived experiences videos because I can sit and talk all day about suicide, but it's not really the same and it doesn't come across with such a powerful story like the ones that are lived experienced. So I'm going to share some resources in the chat. Please let me know if you guys have any questions.
One
Taylor,
thing,
go ahead, Jericho,
oh,
please.
one thing that I think is extremely important about both the role of allies and accomplices and what Christy is sharing with her projects, lived experience campaigns is just how incredibly special and affirming it is for specifically Two-Spirit and LGBTQ plus folks to see themselves depicted in health promotion materials and in some of these like photo shoots and campaigns that we work on. It creates a sense of belonging, and it also helps individuals know that the space that they're about to enter or where they might be seeking services is a safe space where someone will hear them, someone will affirm them, and that they can let their guard down a little bit and show up in this space as their full authentic self with their multiple intersecting identities. So I can't appreciate these two more for the work that they do, how they support me and our work, and hopefully can benefit you all as well.
This was incredibly powerful. Jericho, Taylor, Christy, thank you very, very much. And Taylor, when you were telling your story, I had this hope in my heart that at the end of the presentation that the elder was like, oh, but it was more about the allies and how important the allies are. And that's so moving. It's so true. I'm just wondering if you all could talk a little bit more about the allyship. What's the best way to be an ally? Can you just talk more?
Yeah, I also saw the question about accomplices.
Yeah.
It's a term that isn't just like, oh, I'm standing next to you as an accomplice. You're like actively engaged in the act of supporting somebody, and that's is kind of almost a more active phrase. Um, and it shows a collaborative nature as well. I think there are a lot of ways to be an ally to LGBTQ people. Knowing when the right time to speak is. Sometimes I think it can be a difficult line to walk because you don't want to like silence somebody's experience. It takes a lot of like reading the room. Like for example, there are such, if somebody is misgendering somebody, jumping and being like, oh, you're wrong, that's not their gender, can actually be dangerous as well. So that's not always the best way to be an ally if you're outing somebody in a moment where it might be somebody who's an unsafe person to out you to. So kind of understanding how to walk that line. And I'll let Jericho and Christy also answer this question.
Yeah, I agree with what Taylor shared and expanded on that a little bit more in the chat. An elder once shared that ultimately, like the role of being an accomplice or acting in that role is being willing to use what you know roll up your sleeves and get your hands dirty and do the work that would ultimately be of best service and in the best interests of that community. So really utilizing what you know, who you know, and doing it on behalf of the community in which you're acting in service to.
Yeah, I agree with Jericho and Taylor as well. That's great information. I also personally would share, just to kind of add to that, um, like Taylor mentioned, there's a time when to speak and when to not. Personally, not professionally, for me, I worked with overturning the panic defense law in Washington. And for me as an ally, when interviews came up, it was my time to step aside and really let my two-spirit LGBTQ relatives speak. And that's what a ally looks like sometimes. It's not speaking and it's not taking the spotlight. It's stepping aside for those folks to have those voices.
Wonderful. Thank you very, very much. I hope that everybody on here goes back to watch this recording because it's so powerful. And thank you, Jericho, Taylor, and Christy for being on.
Thanks for having us.
We're now going to move to the SAMHSA update with Tiffany Russell. Tiffany, go ahead.
Thank you so much. And that was a great presentation, and I definitely plan to share all of the things that I've learned during that presentation with my colleagues here, as well as others that I encounter. So thank you for providing all of that information. Really excited to provide you with some updates from the SAMHSA office. We have been extremely busy over the last couple of months, especially these last few weeks, but wanting to share a couple of events that are coming up soon, as well as give you some information because we do need your help on a couple of things. So first, wanting to share that we are introducing a new workshop. It's called Addressing Behavioral Health Crisis in Aging Adults, Reducing Stigma and Enhancing Care. That first workshop is taking place on Thursday, December 12th, from 2:30 to 4 p.m. Eastern Standard Time. And this workshop series aims to improve the understanding of the unique needs of aging adults and the care that they receive during behavioral health crisis. This first workshop is going to delve into the complex relationship between mental health and aging and highlight some of the detrimental effects of stigma and the lack of awareness around mental health conditions in the quality of care for older adults. So we hope that you won't miss this opportunity to join us, to learn and engage and equip yourself with tools to enhance crisis services for older adults. Also want to share that if this interests you at all, that the NBCC approves the workshop for NBCC credit, as well as being approved by the National Association of Social Workers for 1 hour of continuing credit. You can register for this workshop at our TTAC website, and I'll be happy to share and drop that in the chat for anybody who is interested in signing up. Also wanting to share that we are introducing a Children, Youth, and Families Learning Collaborative to build inclusive systems, elevating youth and family voices in crisis response. The 988 office, along with our TTAC, or our Training and Technical Assistance Center, will be launching this learning collaborative, which will begin January 2025 and go through April 2025. Up to 8 states, tribes, territories, and provider organizations will be invited to participate. This learning collaborative will also focus on placing families and those with lived experience at the center of crisis care services design through supporting communities in the design of their crisis care services for children, as well as facilitating peer-to-peer learning and conducting tailored exercises to support states, tribes, and territories based on their unique community needs. This application for this learning collaborative is already open and will stay open until December 12th, 2024, and we will announce the participants on January 6th because the learning collaborative will start in January. So we're really hoping that you will also sign up for that, apply, and we're really excited about that learning collaborative. Here is where we need your participation. Our office is planning to If everything on all of the stars align and everything goes well, we will be welcoming public comment starting tomorrow on our draft of model behavioral health crisis service definitions. We developed the draft model behavioral health crisis service definitions document for states, territories, tribal, and local entities, as well as crisis service providers, public and private payers, regulators, and help seekers and their supporters to clarify and distinguish the different types of crisis services for people across the nation. So again, our goal is to have that document posted tomorrow for public comment. We will send out a communication blast to everyone that is signed up through SAMHSA. And you can also go to our TTAC website for additional information. Public comment will be open for 2 weeks and ends on 12/5 or December 5th, because we do hope to have that document published and available for consumption before the end of this year, no later than the 1st of January. So we really encourage anyone that is interested in providing public comment and feedback on those model crisis service definitions to participate in that public comment. Again, we hope to have that as available as early as tomorrow. So we really need your participation, and thank you so much for your time.
Tiffany, thank you so much. SAMHSA just does fantastic work. We really appreciate your partnership. Thank you for all that you do. We're now going to go to Dr. Jessica Pollard, who is one of the senior behavioral health advisors at the National Association of State Mental Health Program Directors. Please, Dr. Pollard, go ahead.
Thanks, Megan. I'm Jess Pollard. I use she, her pronouns, and thank you for advancing the slide automatically. This is a glimpse of the cover of our paper that I want to highlight today that we developed in partnership with the McKinsey Health Institute. We want to give a lot of credit to for doing heavy lifting around the writing and the very complicated mathing of this economic impact model that I'm going to describe a little bit more in detail, as well as our partners at National Alliance for Mental Illness and the National Council for Mental Wellbeing. This is the simplified link for you to download it, which I hope you'll do. Next slide. But I'll also give you the too long didn't read version, though I really do hope you look at the details of this paper. So here, what we really wanted to highlight is what would happen if we brought the coordinated specialty care model for first episode psychosis to scale. What if it was available for everybody who needed it? So keeping in line with the Kennedy Forum's vision for 90-90-90 by 2033. So what that means is their vision is that 90% of people will be screened for mental health or substance use conditions. 90% who need it will receive evidence-based care appropriate for their challenges, and 90% will achieve recovery, meaningful recovery. So with coordinated specialty care, you've heard us talk about this if you've participated in the JAM before. We know that this team-based model dramatically improves outcomes, everything from quality of life to criminal justice involvement, symptoms, hospitalizations. And we do want to give credit that these programs have significantly grown, or the number of programs has significantly grown over the past 2 decades, thanks to investment from SAMHSA, from CMS. However, the estimate still is that only about 10 to 15% of individuals in the early stages of psychosis have access to coordinated specialty care in the US. That is a really low number. And so what we did with this paper is interviewed experts, including people with living expertise and the research literature, and then put this into a model to show that if we brought that number up to 90% of people having access, we'd save close to $140 billion, billion with a B, over the next 10 years compared to what we have now. And around 800,000 individuals and their families would get access to that care that we know is the gold standard that really helps not only avoid the experiences that can be really frightening, can be debilitating, and can actually even be deadly, but don't have to be. When I say deadly, I mean we see things like a 24 fold increase in mortality in the first year after first episode psychosis diagnosis compared to same age peers. So this is a really serious issue. So we definitely want to see that brought to scale so that everybody who needs it gets the evidence-based practice and adds years to life and life to years. So a lot of steps involved in that, scaling up workforce, et cetera. But we want to make sure that people understand the true impact that this would have, both from a human standpoint and a cost standpoint. So check out the paper, and I'll hand it back to Megan.
Dr. Pollard, that is astounding. That is the most incredible statistics I've ever heard in my life, and the possibility and the vision that could come out of that. So thank you so much for sharing. And I think we want to move to the next slide. Right? Great. So what this slide is all the states, and if they have a picture in the shape of the state, that they have done a feature presentation or done a crisis talk article related to the crisis jam. The ones with the names in the states, we have not had a feature yet or a crisis talk article from. So there are 15 states left. And of course, we would love to include the Pacific jurisdictions as well, and so forth. But we want everybody to have a picture in the shape of their state that they have participated. So if you want to do that, let us know. This next map talks about the 911 surcharge, which is about, on the national average, $1 to $2 per person. And that is, on landlines and mobile phones. But for 988, the surcharge is less. It's 12 cents to 60 cents, and you can see the variation there. But one thing we are excited about and hopeful for is that Texas is pending some legislation related to fees for 988. And you can see what else is pending: Ohio, Pennsylvania, West Virginia, New York. And of course, the ones in gold, there are 9 of them, are comprehensive, and the ones that have a more teal color are partial in terms of their surcharges and fees. So, of course, we want every state, right? So just wanted to show that difference. And so thank you. Let's go to the next slide.
Megan, if we can get a quick comment from Catherine Gilly from NAMI.
Of course. Catherine, are you on?
Yes, thank you.
Wonderful.
Just a little more, we don't have a ton of information yet on the Texas bill that's been introduced. It is a fee bill, but the fee amount has not been specified. And it also contains reporting requirements, which are included in the NASH bid model bill. Also want to flag pending legislation in not pending anymore. Legislation in Pennsylvania, HB 2533 has passed the House. And this would create a public education campaign within the Pennsylvania Department of Human Services to increase public understanding and engagement with the 988 Lifeline. So we'll keep an eye out to see how that goes in the Senate. Thank you.
Great. And Catherine, if you can stay on just a bit, let's see. I know that we're looking at that 20 states have the enhanced match for Medicaid for mobile crisis, and that 6 states have a planning grant only, and that, of course, the states in black don't have anything on that. Do you have any comments on this or any further information?
I don't have any further comments. You can find this map at mariamagiccrisis.org. We'll update it with with any additional states that take advantage of the match. But yeah, no, like David just said in the chat, no movement yet.
Yeah. And so, and just want to highlight again that reimaginecrisis.org /mobile crisis. That's a great website. And so we look forward to that. Wonderful. And so let's go to Pure Central with Arrow Foster. Arrow, please.
Hello. Thank you so much. What a great presentation and a great meeting this has been so far. So staying with the theme of making sure we have the lived experience voice in this. Today I'm turning Pure Central over to a colleague of mine, Michael Running Wolf, who has taught thousands and thousands of people around the world in peer support, certification, as well as many other things. He's also a curriculum writer and an excellent master facilitator, but he has a better insight onto this subject than I. So Mike, take it away.
Hey, thank you, Errol. So of course, my name is Mike, and as I'm sitting here today and I'm listening to all the speakers, especially Jericho, Taylor, and Christy, it reminds me, growing up in the Indigenous community, I did. My tribal affiliation is Numina, also known as Comanche, from West Oklahoma, and I'm reminded that a lot of the Indigenous communities, also known as Native American tribes, are, at least I feel, in a generation of recovery right now. The newer generation is bringing a level of recovery like I think we've never seen before. One thing about the Native nations that stands out to me is that they are nations. Each one is different with their own philosophies, their own thoughts, their own beliefs, and everything like that. The nation that I come from, the Comanches, the philosophy or the thought of two spirits was not something that they themselves were accustomed to, I think, and it has shown over time. I too remember kind of like what Taylor had touched on. Whenever I was a teenager, we were having a tribal council, which we would every month. It's just a part of the way things went. And some individuals from the local college had come there to talk about creating a student-led body there of Indigenous youth, and talking about two-spirit. Now, this is before the term two-spirit came, but they used different wording. And I remember the tribal council shut them down. The elders shut them down at that time. They weren't going to talk about it. And even at that time, even before my own recovery, I remember thinking that there's voices that aren't going to be heard here today, voices that need to be heard, right? And so flash forward now, with a newer generation coming in, we're seeing a lot of healing, right? The conversations are starting, and they're starting with the tribal councils, Indigenous celebrations such as powwows, and I'm excited. I'm excited for the future of our Indigenous community and our Native American tribes. So I just wanted to voice that. So thank you, Arrow, for giving me a few minutes to add to that.
Without a doubt, Mike, I always respect your opinions and the way you speak with such care and, as you said, healing manner when you speak about these things. Thank you so much, Michael. Megan, back over to you.
Thank you so much to both of you. And thank you for your reflections. I do want to go to Stephanie Hepburn to do the crisis talk article. Stephanie.
Thank you. So I'm going to bring on Jamie Craig. She's a senior technical writer and consults behavioral health organizations on 988 and workplace development. Jamie, in this week's opinion, you shared that supporting the mental health workforce is dire. Can you tell us about your own experience and also how the workforce should be supported?
Certainly. Hi, thank you for having me. It's nice to see you here. As I wrote in the piece, my own experience comes from, well, I have lived experience, and one day I was at a crossroads and a complete loss, and thankfully I had had the privilege of witnessing and writing for the developers of the 988 program when as part of my work with SAMHSA, a contractor for them. And that day that I knew I needed to call, but I hesitated because there is this, I call it emergency indoctrination. And when we look at the marketing for 988, we do see that it's a suicide hotline. But from my meetings, I knew that I could call just because not only was my loved one having an emotional crisis, but it was causing one for me too. And I really didn't know what to do. So I could hear their voices, and thankfully that outweighed my hesitation. And I called, and it was just an amazing experience. I was met with compassion. I mean, I kind of get choked up even thinking about it, because that moment was such a turning point, and I just needed someone to hold my hand. And it wasn't just in that moment, the follow-up was there. And I think one of the things that was so cool for me was that I heard that would happen. Oh, I heard about that. And here it was from people who were local and thorough. And I'll never forget it. And so I'm kind of a poster girl for this movement and for the awareness campaign. And I ask, and you're right, at the top of the hour, someone said, the poll about who knows about 988, it'll grow. People look at me funny, like, what is that? And I say, well, just 911 had to take a while too. So it was, I'm honored to spread the word and to have such a great experience. And I know everybody's experience is different. And also, I didn't use my pronouns. They are she and her. And I have a very diverse family. And so I appreciate that we are trying to figure it out for all the populations that call. One of the things that experience did is it really increased my already deep appreciation for the workforce, and realizing that, I mean, before I started working with SAMHSA, I just never really thought I had been in, a consumer of mental health services, but I had never really thought about what the people in the workforce are going through. And when I started thinking, okay, how else can I help stem the tide of the burden on the workforce and the shortage? I didn't know there was a shortage until I started writing for these expert panels and these convenings. So I really wanted to roll up my sleeves and offer an even deeper experience. And so I'm a certified mediator and facilitator. I taught conflict resolution in the workplace for 9 years on the graduate level. It's one of my passions because, well, that's a whole nother story. Trust me, I need to know it. And so I started thinking, well, this is an even richer way to give back and to get involved and help stem this tide of pressure. And I learned that some experts are saying that workplace stress is the 5th leading cause of death in America. Well, that got my attention. I thought, well, what on earth? And of course, after I started thinking about it, it's like, oh yeah, okay, stress, burnout, turnover, conflict. I mean, the cost is so high to the individual and the organization. So I started to reach out and offer these kinds of trainings and mediation and facilitation. They have a great ROI. So it feels really good to be able to offer something that I have experienced, that I'm passionate about, and that will really, really make a difference for individuals and organizations. I think it's interesting that the National Safety Council says that employers have a responsibility to address mental health and support employees, support their well-being, including, they even go on to say, reducing or eliminating workplace stressors. Well, that's nice, but what's the YBH, the yes, but how? Like, that sounds good, and how are we going to do it? So I appreciate being able to offer that YBH to organizations that that really want to help their employees and help themselves and help the people they're helping. So we're all in it together, right? In it to win it. So thanks for asking, Stephanie. I appreciate it.
Thanks for joining me.
Mm-hmm.
And Jamie, just thank you so much for your perspective. It's such a wonderful way to wrap up today. And just want to remind everybody, there is no 988 Crisis Jam, November 27th for the Thanksgiving holiday. But after that, on December 4th, it's on CIT training to meet youth needs with Bobby Tanier. And then that'll be episode 200. And on December 11th, there's a debate. And so Arrow Foster and Dr. Renee Keat will be debating with Dr. Ursula Whiteside as the moderator. So we hope you'll join us for that exciting piece. Thank you so much for watching. We'll see you December 4th.